There's been a lot of controversy around intraoperative radiation therapy. We've obviously have seen the segment on NBC that talks about it. Do you want to just tell me a little bit about what intraoperative radiation therapy is?
Yeah, so intraoperative radiation therapy is one of the options for treating breast cancer, particularly for very early stage, low risk breast cancers. So what it is that me as the radiation oncologist, I work very closely with yourself in the OR, and after the tumor is taken out by surgery, then you're able to actually place a balloon inside the patient's tumor cavity. So it's right up against exactly where the tumor used to be.
Yeah.
Then there's a small source that goes into that balloon and gives a small area of radiation to the cavity and that surrounding tissue around there. So the convenient aspects of it is that it's done all at once during the surgery, and the actual dose of the radiation and the amount of tissue that gets radiation dose is very small, which has its pros and cons, which is why it's really for the early stage patients.
Yeah, so we've been doing it for a while now. What do you think is like the hardest part of being able to do intraoperative radiation?
Yeah, intraoperative radiation, first selecting the correct patient for it, and after thorough discussion so that they know the risks and benefits of different approaches of radiation. So that's the first step, is making sure that patients are very aware of all their options.
Right.
Thankfully, we're able to do that here with our multidisciplinary clinic, where the patient's able to see the surgeon, radiation oncologist, and medical oncologist up front.
Yeah.
So coordinating that to make sure it's a very informed decision is a difficult portion. And then also logistically, having radiation oncologists able to go up to the operating room and having the physics staff support, it is challenging because it requires many people to be involved at a very specific time during a surgery.
Exactly. It's like when I call, you have to come, and that's, because we can't leave the patient open and waiting. So it's definitely logistically challenging. But I think from also my perspective, when I talk to patients about it, it's like, we don't know what you really have yet. We don't know how small it is. We don't know if the lymph nodes are positive. So just making them understand that this is really a good choice for very small early cancers, and sometimes we'll go into the operating room thinking we're going to do it, and unfortunately it's not the right option for them because we find out something that's different about their cancer. So there's a lot of uncertainty that goes with it, but I do love being able to have that as an option, right? I'm sure when you talk to them too.
Yeah, it's very nice to have the whole gamut of options. So a lot of patients that are intraoperative radiation candidates are also great candidates for doing partial breast radiation, and even in some cases, no radiation at all. So finding that balance of what the patient wishes are in terms of local control and also toxicity, and balancing that with convenience of treatment is a fine line. And we talk to the patients about the literature behind intraoperative radiation, partial breast radiation, the ASTRO guidelines. They're also enrolled on a prospective registry, so just being able to have the options is really important.
Yeah, for sure. I think patients who have to travel from far, intraoperative sometimes is a great option, especially here in LA with the traffic. Trying to get someplace every single day is quite the undertaking. So I think having that option is always a plus. Now there's a lot of talk, especially in the segment, about local recurrence being an issue, right? Saying it's not as good. What do you think about that?
Yeah, so the largest trial, at least for the technique that we use here at St. John's, was the Target A trial. And there is a small increased risk of recurrence with doing intraop radiation when they compared it to whole breast radiation on those trials.
Yeah.
Those trials were, given to a wide range of patients, and, really selecting the right patient population is the most important factor.
Right.
But also discussing with patients that there is a small 1% difference that was seen at 5 years, and that's an important consideration for a lot of patients. 1% at 5 years might be very different for a patient in their 50s, 60s versus someone that's in their 80s.
Yeah.
So being able to balance that and speak about the literature and the guidelines nationally is very important.
Yeah, and I think about that 1%, it may be important, like you said, for some, but then there's also the side effects of whole breast radiation and what, definitely less side effects with less radiation in the intraoperative. So it's not kind of black and white. It's not like one is good and the other isn't. It's just trying to figure out who is the best candidate for what, and what their risks may be, so that we can minimize risk but maximum benefit. Yeah.
And there's a large continuum, even for early stage patients that are young, and there's trials right now looking at de-escalating different therapies to really make it an individualized patient decision. And this allows us to just add another option for patients on top of a very also standard option of doing partial breast radiation, which is convenient as well.
Yeah,
but
for sure.
just being able to have the option and discussions is important for patients to hear about.
Exactly. I mean, that's what I appreciate most about working here so closely with you guys. You guys are right there next door to us, and then we operate right upstairs. So having that convenience, but also just, having that mindset of like, how can we do it better, right? Sharing information and really kind of talking through all of the patient's choices with them and helping them decide what's best is really kind of a special thing about this place. So I'm really fortunate to have you guys right there so that we can have these, dynamic discussions, especially through tumor board and all of the multidisciplinary clinics that we have, so that patients can get the best thing possible.
Yeah, we're lucky to have the expertise of being able to put the radiation device right in that cavity is also, it does take away some of the uncertainties.
Right.
Because we know exactly where the tumor was before we do the radiation in that setting.
Yeah.
We're able to do it post-operatively as well, but it does give a very small rim of tissue radiation.
Yeah.
The pros and cons of that, as you were discussing, was that there's less side effects, which is true because it's really about a 5mm rim that's getting most of the radiation dose.
Right.
The benefit of that is there's less fibrosis in that region and of the surrounding tissue that's getting less radiation. But one of the potential downsides is that there's a tumor cell that's just beyond that reach, then the radiation is actually not touching that area, which is why patient selection is so important.
Yeah.
And there is evidence that doing whole breast radiation after intraoperative radiation can have a little bit higher fibrosis than just doing whole breast or partial breast to start with. So that's kind of all compounded into our discussions with patients before we opt for this type of treatment.
Yeah, I think people don't realize how much interplay there is between the specialties when it comes to breast cancer care. It's not just, here's a cancer, take it out, and then we'll see what happens. There is a lot of that discussion, like maybe chemo needs to go first, maybe this will impact your radiation, or maybe they don't like the radiation, we'll change the surgery. And so having that discussion up front with the entire team, I think, is so important. It's definitely not a one size fits all, and it's a lot more involved than, saying this is the right thing and this is the wrong thing to do. So. But we're very lucky to have each other.
Yeah, definitely.
If anybody has any questions, please do reach out to us. We would love to see you and help in any way we can.